with a specific background, not out of curiosity, but in order to treat properly. Palliative care should be integrated with other programs, and it is uniquely about living as well as dying. Palliative care plays an important role in the care of patients living with chronic and life-threatening illnesses, such as cancer and other chronic conditions, now called NCDs. It provides relief from pain and other distressing symptoms, as well as integrating the psychosocial and spiritual aspects of patients' care. And on that note, I think I should emphasize the spiritual aspects of patient care. We should involve some of the so-called prophets and pastors in the palliative care process, because that may be more important to the patient than the alleviation of pain per se. Palliative care team then is very important as an aspect to address the
palliative care is treatment to relieve rather than to cure symptoms associated with life-threatening illnesses and conditions. Palliative care can help people live more comfortably. It is an urgent humanitarian need for people worldwide with cancer and other chronic fatal diseases, especially those with advanced stages where there is little chance for cure. Each year, an estimated 40 million people are in need of palliative care. 78% of them live in low and middle income countries. Worldwide, only about 14% of people who need palliative care currently receive it. Relief from physical, psychosocial, and spiritual problems can be achieved in over 90% of advanced cancer patients through palliative care. Improved access to adequate amounts of oral morphine is mandatory for the treatment of moderate to severe cancer pain, which is suffered by over 80% of cancer patients in terminal phase. Overly restrictive regulations for morphine and other essential controlled palliative medicines deny access to adequate pain relief and palliative care. Because of the emotional, spiritual, social, and economic consequences of cancer and its management, palliative care services addressing the needs of patients and their families from the time of diagnosis can improve the quality of life and the ability to cope effectively. Effective palliative care services should be integrated into the existing health system at all levels of care, especially community and home-based care. They involve the public and the private sector and are adapted to the specific cultural, social, and economic settings. Palliative care should be included in the continuum of care for people with chronic and life-threatening conditions, linking it to prevention, early detection, and treatment programs. This includes, as a minimum, 1, health system policies that integrate palliative care services into the structure and financing of national healthcare systems at all levels of care. 2, policies for strengthening and expanding human resources, including training of existing health professionals, embedding palliative care into the core curricula of all new health professionals, as well as educating volunteers and the public. And finally, a medicines policy which ensures the availability of essential medicines for managing symptoms, in particular opioid analgesics, for the relief of pain and respiratory distress.
It's not just about cancer. And there are also confusions which I've seen. Palliative care, sometimes hospice. It's also unfortunate when you look internationally, because in other countries, when you hear the word hospice, again, people think I'm dying. Like, for example, in the medical system, you can only be referred to a hospice center when the doctors think you've got 6 months of life remaining in you. And even the medical aids can only pay for you if 2 doctors have certified that, okay, we think from our medical expertise, this person is sick. So you are referred to a hospice. So you can see it can reinforce those mentalities. So when someone is referred to Allen Hospice, I still remember when I was at Allen Hospice sometime, a gentleman was referred from Parinya to Allen Hospice. Maybe the doctors had not communicated with that husband. The wife was quite advanced. So when they came and the history was being taken into, he was asking, what do you do here? When we saw the word hospice. He said, no, I thought I was just going to some center where they are going to give more expert advice. He was very furious and he walked away. Because to him, hospice, it means you are giving up on my wife, you are giving up on the patient. So that's one of the confusion. And also the other confusion, when you hear someone talk about terminal illness, people think palliative care is just for people who are terminally ill. And I think it was well mentioned, even by Eunice and others, that palliative care, once we diagnose you with any life-threatening illness, whether it's cancer, whether it's even HIV itself, it's a life-threatening illness. Yes, we know now, people, we say it's a chronic disease and so on, but there are other complications which can come with even the HIV, whether it's complications from the medications or the disease itself. In a way, the communication aspect, when you go to the OI clinic and so on, is part of that palliative care. You're not getting morphine, because that's another misconception. When I go to Dr. Chifamba, I go to Allen Hospice or to a palliative care practitioner, I'm going to be given morphine. It's not about morphine. It can be the communication aspect.
Earlier on, he said, Ministry of Health does not need any publicity. Ministry of Health does not need any publicity. And I thought, wow, this is our day. All members of Hospice, all partners, all friends and everyone, it's our day. So just say where you are sitting, it's our day. Can you just say that? It's our day. It is our day.
It is our day.
This thing is no longer working. So I'm going to talk briefly about who Hospice is and a little bit on what palliative care is, why this day, and so on. So Hospice is an umbrella body, it's a membership umbrella body, it's a national body in Zimbabwe that supports palliative care providers and promote palliative care in Zimbabwe. And how do we do that? We do that through training. We do a lot of capacity building of health professionals right down to the community level. And we also do mentoring. We don't just train and leave you like that. We will train you and follow you up until you are able to stand on your own, then we can leave and do other things. We develop a lot of materials. We are very good at developing materials. Many of our materials have been taken by Ministry of Health and Child Care as their own as national materials, like manuals and NIC materials which we develop. We also do a lot of coordinating strategy and policy development. And some of the policies, like the palliative care policy, we were given the permission by the Ministry of Health and Child Care to lead and coordinate that, and we did, and we are proud that we do have a palliative care policy. We also do a lot of quality assurance. We want to see that people get quality care, and therefore we do a lot of setting, recommending, and monitoring standards of care, so that our people who are sick and our people who are bereaved can get quality services from us. We do a lot of advocacy. Like today, we are advocating for palliative care in Zimbabwe. We are joining the world in actually advocating for palliative care. We do a lot of coordination of activities with our members. We work together. We don't work in isolation. Anything we do and it's good, it is because our members who help us do that. So our goal really is to promote a comprehensive community approach to palliative care, starting from diagnosis until the person dies, but we will carry on supporting the families until bereavement and so on. Now, we want to see why palliative care. What is this morning's palliative care? I will say in Shona, kuchengeta murwere kuzere, kwemhando yepamusoro-soro, techipodza marwadzo anouya neurwere. Handiti nemarwadzo anouya nekufirwa. Ende marwadzo aya anogona kunge ari pamunhu mukuru kana marwadzo aya anogona kunge ari pamunhu mudiki. Zvatinongoita zvepalliative care zvakafanana, toda kuti vagare vasingarwadziwe. And therefore palliative care is about controlling pain and relieving suffering. Palliative care looks at the whole person, including their families. And therefore, really we look at the emotional, we look at the spiritual, we look at the physical, we look at the social. So in Shona, it's magariro emunhu, mwiri wake kurwadza kwaunoita, chitendero chake, nezvinomushungurudza pamweya wake.
And other stories, visit our website www.263chat.com. Follow us on Twitter @263chat and like our Facebook page 263chat.